Hello YouTube, this is Hutton Harmon with the week 4 update of my AC joint repair surgery. Once again, it was a grade 3, and I'm just zooming in so you can see the incision site. I'll try and get a good view. As you can see, the scar is like very light, and it's almost like when you zoom out, you can barely tell that it's there. So I'm hoping that gets better with time. I'm not sure if I just got lucky or whatever, but I wasn't really putting anything on the scar. I just kind of followed the instructions from the physician assistant and my doctor, and they just said to leave it alone and just keep the suture tape on until it falls off, and that's what I'm left with. I mean, it doesn't look beautiful, but it's definitely better than uh, the collarbone sticking up and that deformity. So I guess that's a good thing. Um, as far as the progress, I mean, week 3 to 4, major progress. I basically retired the sling altogether because it was kind of just getting in the way. Like I didn't really notice any difference of using it and not using it, and I was also getting worried about wearing it, too much. Like, what was that gonna the counter benefits of like wearing it too much, whereas like is it going to make my arm like more stiffer like unnecessarily. So I mean, I retired it. I'm not really noticing any like cons from doing so, so I'm just going to continue to not really use it unless I feel any type of pressure or pain in that area. um, and I've also been doing like a lot more activity than the prior weeks. So I'm back to running full speed this week, 8 miles per hour for 4 miles. So that's really fun. I mean, I'm so glad that I'm back to like somewhat of a workout routine that I was used to. And then I'm lifting on this side. This side's looking a lot better than it was when I was first in the hospital. This side has a lot of work to do. As you can see, it looks like a flat tire. Um, but I actually have something going for that too. I invested in one of those EMS machines. EMS is like electronic muscle stimulating. So it has 4 pads, and I just connect it onto the shoulder and then on the bicep, and just let that go for like 30-minute sessions, just to see if I can combat the atrophy there and just kind of get something going on that side. I'm not really lifting any weights, at least not as much as I would like to yet, because I can't, uh, to not risk damaging that repair. But I have been doing. I mean, I've been breaking some of the rules like that they tell you to do. They tell you not to lift anything on either side really for the first 6 weeks. I've been lifting on this side for 2 weeks now. But I haven't experienced any pain like coming from this surgery site. So I took that as, I took the risk on my own, and I took the response my body was taking. I was feeling better, so I was understanding like for me, like maybe it's not the worst thing to do to try and get back into weight training, at least on the good side, and the areas of muscle that I can train right now, and then just leave this for last. But then on this side, this week I incorporated a 10-pound weight. Nothing crazy, nothing overhead either, but like, just to try and get my technique, back, and kind of like get my arm used to doing those motions. So when I do initially go to my normal weights that I lift, I lift on this side, I lift like a 40-pound dumbbell. I mean, I was doing 40-pound dumbbells before the injury. So I would like to get back to that, but I know that's going to be a long way from now, because I don't want to risk damaging this. So realistically, I'm not going to be doing any of that on this side until I don't think this, it's not going to happen this year. Maybe early year 2025, or hopefully by spring, once I'm clear through all this and clear through all the physical therapy, I can return to heavy weightlifting. Um, but so there is some good and some bad. Some of the bad is like, I just miss being like as active as I was. I am experiencing some like limitations, that hopefully get resolved in physical therapy. Meaning that when I do lift this arm, I do get a little bit of, like stiffness, and just doesn't feel great to really lift this arm on its own. But I'm being patient, and it's only been 4 weeks since my surgery, so I'm not expecting like full range of motion yet. Range of motion is okay, but it's definitely not where I would love to be. Like I can lift my arm. I have some range of motion there. Um, but I miss being able to lift weights over my head and pull ups and push ups and all that stuff too. Um, but some of the good things is that I've been doing a lot better job of like giving my body enough time to rest, going to sleep on time. Dieting is super easy now because I'm so focused on like just making the right moves to let my body heal, that I'm not going to pollute it with any junk food or anything like that. So I'm just I'm sticking to my diet. I'm doing intermittent fasting during the day. Just like fruit water. I do have a cup of coffee every day, but even that helps with like your metabolism and just keeping your energy levels and your blood pressure, everything flowing really nice and smooth throughout the day. So I mean, overall, I'm pretty happy with the progress that's been made, and then also where I'm just at in general. I mean, I'm just grateful that they did the surgery for me, and I'm hoping for the best. I definitely have realistic expectations. I'm not expecting everything to just go away overnight. So I'm willing to do the hard work that it's going to take to get to where I want to be. But the hardest part about that is just being patient and not rushing it. So that's kind of where I'm at now. Is just understanding how to be patient and just let the results come, with time. And just for some advice for anybody that's dealing with this, I may have began higher activity than what they tell you or what they suggest that you do when you're healing. So don't exactly follow like what I'm doing because it works for me. Everybody's body's going to be different. Just like with this scar, I mean, if you look at some of the other videos on YouTube, you'll see the scars are a lot more darker in color or whatever. Everybody's body is different. To make a long story short, and so you definitely need to listen to your body and what is going to be capable for you and what's not going to bring on more pain or trauma to your body, especially to the surgery site, because that's going to be counterproductive. I did experience some I guess counterproductive feelings from some of the added activity that I've been doing. So I just want to, I definitely want to use these videos, not for attention or anything, but just to help anybody that's like dealing with this. You have to take it easy. You got to take it slow. You got to learn how to be patient. And my belief is that with these repair surgeries for the AC joint, that they will work. It's just a matter of time and a matter of following all the procedures, all the phases correctly. But essentially, if you're getting it repaired from where you're at, I mean, it's going to be repaired. So you just got to allow that to happen. You don't want to make the mistake of messing up the hard work of the doctors and the surgeons when they dedicate their time to repair your body. So I just wanted to touch on that a little bit because I feel like that's the best service that these videos can do. And I know it's not the most interesting thing, with a weekly update of my injury, but for anybody that's actually dealing with this, some of this information is going to be very valuable to you. So I just wish you the best of luck and just remain positive, stay patient, stay calm, make your plan. I mean, I've been preaching that every video that I've made. I've said make a plan and stick to your plan and just have faith because you can bet that I have a calendar that like I'm counting the days down every day, and every day it seems like something is getting better in some way. Even if it's not with the injury, like some aspect of life is getting better because you're just in this healing mentality, that like you're you're taking all the little things, and instead of taking them for granted, like you're finding value in it. So that's definitely where I want to leave this off with. This week progression was one of the better ones, and I don't. It feels like I'm expecting more, but like when I actually sit back and think of like all the progression that's been made since the surgery, like I'm amazed because you go from wearing that sling every day, and you can't move your arm. Um, you're in pain, you're in bed. Like some people are taking the pain medication, so that's something that they have to deal with too. To now you're actually you're somewhat living again. I mean, I was able to do my yard work. I'm out of the sling now, so it's like I'm free from that like that captivity of keeping my arm all compressed all day. So, I mean, I just can't wait. I can't wait for things to get better, and I'm hoping that everybody else is doing well that's dealing with this too, whether you got the surgery or not. Some of the benefits from not getting the surgery is that I feel like it's almost like a faster recovery if you go through the physical therapy and stuff, and if that's going to work, like if that route's actually going to work for like your lifestyle, like that's actually going to be quicker, and you don't have to go back in time and restart from day one when you originally got hurt. Because what happened for me is that like I knew I would have recovered pretty well not getting the surgery, but I wasn't satisfied with that. And I was also worried about in the future, if it's going to be more beneficial to get it repaired. So I opted to get that. So I'm feeling good about it now. I mean, it's just a matter of time. It's September 17th. It's a Tuesday today. So I'm not really expecting to like really feel like going down the hill until like about like October or November. But that's going to be here before you know it. And we'll see how these weekly updates, I'm going to keep you updated with any type of progression that I had. So I just want to just let you know where I'm at, everybody. Week 4, the best week by far. Best week by far that I've been experienced. I mean, I'm back to my cardio workout. I feel like I'm at like 50% with my weightlifting regimen because I'm able to do everything on this side, but I just have to kind of get caught up on this side, on the injured side. The scars doing very well. So, I mean, I don't really have much to complain about. So I'm just being grateful for everything that is going well. Can't wait to get back on that skateboard, though. I'll tell you that much right now. When I do, I'm going to go hard. But I'm going to also be careful because I'm not going to rush into crazy stuff because I don't want to re-injure this and I don't want to get another surgery. So we'll see. I will see you next week. It'll be week 5. I'm not starting physical therapy. That's another thing I wanted to touch on is like I'm not rushing into physical therapy because I'm basically getting my arm in motion. And I'm going to wait the full 6 weeks just so, with that added on top of the stuff that I'm doing on my end, I don't want to take any risks that I don't need to take. So I'm just going to wait the full 6 weeks. I got 2 more weeks to go until the physical therapy. And then it's like off to the races after that because I'm going to be really dedicated and doing a good job with that. And just trying to get back into weight training as soon as possible. But I can't wait to hear what they say, what they suggest. And I may have to tell them, I kind of cheated and got into some stuff that wasn't suggested to do yet. But everything's going pretty well, and I'll see you guys in a week. Thank you very much for watching, and take care.